won't entertain that, but because we are where we are, maybe we should. So is there anybody who didn't speak on Thursday last who is available now to comment on what Tracy said?
Chair, I thought Dr. Sharon did not have a chance Thursday, and Mr. Doran Barnes. Those were the only two.
Oh, who's Sharon? Is she the Saika Sharon?
No, from NCSA.
Oh, right. Okay, is she here?
Yes, she is here, Chair.
Okay, well, welcome everybody, in particular the stakeholders. There are two stakeholders left. In future, if you leave a meeting, we will not entertain you again. We're allowing this because the meeting spilled over 12 o'clock, but also because we gave you the latitude you don't have in other committees. So you can't have your cake and eat it, as it were. So in future, in Kululeka, if people leave, given that there is no rule that requires us to have this process, we're the only committee that does it, as far as I know, and maybe the Standing Committee on Finance as introduced in the last term. So there's no rule that provides for this. I have discussed it with Frank Jenkins, the Legal Services Unit. In future, in Kululeka, if people leave, then, well, we're also spending our hours in the evening sitting and listening to them when it's not a requirement, really. As you know, in Kululeka, ours is the only committee, as I said, that I know that does this. So that is my ruling. There's nothing further to discuss there because there's no, if people want to discuss it offline, fine. We've got important issues to discuss today. But before we invite Sharon to speak, I should clarify something, which is confusing. So firstly, I discovered to my horror on Sunday evening that the House program still has us voting on these three bills on Wednesday afternoon, when in fact the committee will only meet tomorrow morning to finalize the voting. Now, the reason that's there is because some 6 weeks ago, they put that down based on our initial draft program. So in Kululeka, I'll discuss with you offline from now and make it very clear, as we did in SCOF for 5 years, in which we asked you to do the first time around and we just ignored it, is to put on the top that it's a provisional program based on factors often beyond the control of the committee, something like sometimes it's very difficult to predict the number of hours or days required to process a bill, etc. Okay, we'll talk offline. So there was a misunderstanding. It's now been sorted out. It is not possible for a committee to vote on the bill in the morning or on the bills in this case, and then vote in the House in the afternoon. That's not allowed. It's not even rational. So it was all sorted out. It's postponed to next Tuesday, the debate. But we would like to finish tomorrow because there are other commitments we have in the Appropriations Committee. Remember, the NA votes today on the appropriations bill. I think today the committee does, tomorrow and the bill comes to us immediately thereafter. So we are the same members in both committees, and obviously that becomes our primary obligation. So that said, we need to move on. There's no debate in the House tomorrow, obviously. Okay, Sharon, over to you. I'm giving you up to, and I'll monitor you, 3 to 5 minutes at the maximum. Do you want to respond quickly? Okay, go for it.
Thank you, Chair. So we would like to just acknowledge and appreciate the process of engagement by the committee. And we have had the responses tendered in by the National Treasury that any amendments should consider the impact of illicit trade, the capacity of SARS, and the negative health impact of tobacco. So our response to that is that we hope that the order in which these considerations are given is not based on priority, because we feel that the priority should still be the negative health impact of tobacco. Yes, there is the issue of illicit trade, but according to the Tobacco Atlas globally, 98% of illicit trades are actually coming from the legitimate tobacco manufacturing companies themselves. So whilst we don't know the proportion of how much come from the legitimate in South Africa, studies undertaken in the hard lockdown, for example, showed that the products on the illicit market were actually from legitimate companies. That is not to say then that illicit trade is not a problem, and that it's not a legitimate problem. It is, and enforcement should, we agree, be strengthened, and that the protocol to eliminate illicit trade should be ratified, and that an independent track and trace system really is needed. But all these steps should be taken simultaneously with large tax increases, because it would really be disappointing to watch the illicit trade argument being successfully used to stop tobacco control policies, including increasing the taxes. So we still believe that the negative impact of tobacco should really be the primary consideration, that 150 South Africans are dying each and every day from tobacco illnesses, that there is a non-communicable disease tsunami that the Minister of Health has cautioned, that still, using tobacco is still, linked to, the communicable disease burden with the HIV and the TB diseases as well. So we believe that all these things should be considered, but, the health burden should really be the key consideration, and that this actually does weigh heavily on the health budget that is currently unsustainable, and that this actually also affects our economy. And lastly, my response is really on the issue of the 40% guideline. We still believe that we should be following the WHO, the World Health Organization, which says 75% of the retail price should actually be going to tobacco taxes. Thank you.
Thank you, Sharon. Right, members, Sharon, we did have an engagement around these issues last week, Thursday, and we heard you. You're quite predictable. It's right what you're arguing from your point of view. But when I say it's predictable, I'm not saying you shouldn't say it a million times. That's your right. And we should listen to you a million times because it's a big issue. So it's not to take away the value of what you're saying. I'm just saying we're familiar. See, this is an easy issue. Let me explain, Sharon. That dealing with the complexities of the bursary matter or the export of scrap metal. Do you see? Those are like challenging for us technically. We're not experts in those areas, right? We're not tax experts, but this is something that we are familiar with. The only issue is what do we think? And now, by the way, all ANC members, we have to meet at 1 o'clock. Comrade Njadu is pulling together a study group meeting so that we finalize our positions before we come in tomorrow. So please, those of you who are here, the link will be sent to you shortly. Okay, let's come back to the point. Is anybody wants to raise anything further? Any hand up, Nkululeko?
Not at all.
Let me look at the management. Not at all. Okay, look, firstly, Sharon, the way I understand it, remember, I'm merely the chairperson. And, I just have one vote, although chairpersons do, by the nature of our roles, sometimes manage to exercise influence over the study groups and committees, and sometimes they don't. And that's the way democracy works. But for what it's worth, my own view and what I think is the view of the majority party is that firstly, the issue isn't that we shouldn't impose tax or that we shouldn't impose increases, and I think we welcome it. But the issue is how much and how. And we have to be fair because whatever our views are as members of parliament, as I keep reminding the members, we have to accept that, smoking is not illegal in this country. And therefore, we have to accept that there will be smoking and there will be tax until the laws are changed, if they are changed at all. Sorry about this. Secondly, the Standing Committee on Finance in the last term began to focus more and more on the illicit tobacco trade. In fact, there were two maybe major sittings where everybody was brought together. If I recall correctly, it also included all the tobacco, both those who engage in legal and illegal activities, those who engage only in legal activities, and those who it said engage in illegal activities only, right? You know the permutations better than we do. And we agreed on a program of action, and then it was inserted into the quarterly program where SARS and National Treasury reports. When there were two meetings, one major one, I think as I recall it, we had the Hawks there and we had a whole lot of people. At that stage, SARS was severely challenged and the illicit economy structure was changed substantially and so on. But all of that is back on track, as I recall. Mr. Kieswetter, the new SARS commissioner, has been focusing on that. And we all have to work together, civil society, yourselves no less, and ourselves on dealing with it. It is very instructive what you say. It's coming across more starkly now than before, that it's not just the so-called illicit traders in tobacco that are taking part in it, but also the established companies that are in the legal sphere. They also do the same. Okay, so there we are. We'll move on and say that I think the view is yes to the tax, but there may be questions about the rate and also about how it's being done and what the criteria is, but that each committee now, each study group of the parties. We can't discuss this endlessly. We'll take its own decision on and come back to the committee on tomorrow. But can we move on to the next issue? Who's here in Kululeko?
It was supposed to be Mr. Doran Barnes, but he's not here in the platform. I don't see him,
Fine.
Chair.
Okay. If that's done, then there were the outstanding issues which were not dealt with last week, mostly involving people who sent written submissions only. Am I right, in Kululeko?
That's correct, Chair.
Good. Okay. So now over to you, Yanga, and your team. Can you reply on each of the issues? As we did last week, we'll stop on each issue and ask members what their contributions are, if any. Thank you. Over to you, Yanga.
Thank you, Chair. I don't know whether Nkululeko has got the slides or Chris has got the slides.
Our previous slides, Yanga?
Yes.
Yes, let me get them and then I can put them up.
Hello?
Yes, let me get them and I'll put them up. I'll just be a minute.
Okay.
Almost there.
Okay. And I think last week I stopped at unbundling transactions. So today we're going to start income tax, business tax incentives. That is the review of special economic zone tax incentive regime. And Chris, you can do that.
Okay, can you see the screen?
Yeah, we can see it.
Okay, great.
Chris, can you please go to the slides dealing with
Chris, you may be muted. It's on.
income tax, business tax incentive? I think it's slide 70.
Okay, yeah, there we go. Okay, so okay, I'm not muted. On the, I think we did talk about the 10-year rule. So I think we did talk about that. I think we might have been at REITs, Yanga.
Okay. On amendments to REITs tax dispensation is slide 75. In the 2020 TLAP, we made
collaboration with and in support of the national strategy, so working very closely not only with the National Department of Health at a national, provincial and local level, but other arms of government to ensure that we don't duplicate or replicate, but that we indeed supplement the efforts that are taking place. At all times ensuring that not only do we account, as I said, for our disbursements, but we ensure that we are as much as possible. And in fact, for the last 8 months, we've been able to demonstrate that we're a frictionless organization, that there have been no costs directly incurred, that donors, that their funds have gone directly to the beneficiaries that are required. As I said, we are not subject to the procurement legislation or regulation of government because we're not an arm of government, but we have ensured, and we'll elaborate upon this, and I'm sure you'll have questions as to how we can satisfy not only Parliament, but most importantly, the public at large, that all donations are properly and appropriately accounted for, or procurement goes directly to source. And then finally, as I said, that the speed and agility that is a hallmark of the Solidarity Fund underpins our role as a rapid response vehicle, recognizing that government was unable to mobilize as quickly as we were, but obviously it has much more significant resources that it can now bring to bear. If I can now